My name is Ngao Mavuna. I work for Action Network for the Disabled. I'm the project coordinator. I'm majorly working on issues on advocacy for persons with disabilities.
My name is Elsie Mulindi, and I'm the Chief Executive Officer of Kenyan Paraplegic Organization. At KPO, we empower persons with disability, specifically physical disability, and wheelchair users for that matter, to be able to lead dignified lives, to maximize their potential, and to be able to participate in the society.
My name is Charles Ogutu. I work for this organization, Haki Group. I'm the CEO. Haki Group is a community-based organization working in Kibra, and we exist to work for children.
My name is Jean Karaoke. I work with the Ministry of Education. I work at the Education Assessment and Resource Center. What I normally do in my office here is assessment of children with special needs and disabilities. I do assessment for either placement in schools, or I refer for referral purposes to the medical personnel.
My name is Diana Moya. I am an EAC coordinator, meaning that I coordinate educational assessment and resource services to our children with disabilities in our schools in Machakos County.
Mimi naitwa Lydia Kanini. Ni CEO wa Lydia Kanini Disabilities Foundation. Na pia ni coordinator wa Kwale County Disability Network. Kazi yangu ni kushughulikia walemavu, kuambia rights zao, na pia kuwasaidia wale ambao wanahitaji msaada ambao wanaweza.
Mimi naitwa Ngige Steve Nyaga, ni katibu wa Kirinyaga County Disability Organization, na wamenichagua kama official spokesperson wa walemavu katika Kirinyaga County. Yes.
Key to all our programs is advocacy, and I work more on advocacy issues of persons with disability, and key to the project which actually we got from our Commonwealth Foundation Fund. We work closely with Able Child Africa, and we are looking on strengthening community service organizations and disabled persons organizations on how actually to look on disability and child rights as one. Because most of the disabled persons organizations in Kenya, they look as disability rights and child rights in reflection to disability as two different entities. Like most of the grassroots disabled organizations did not understand this component. Like child rights and disability rights must be all be the same thing. And that's what actually informed on coming up with this project between Action Network for the Disabled and Able Child Africa in UK. The project has been running for the last 3 years, and because of COVID, we had a cost extension period of another 6 months, so that at least we cover up what was not able to be done during the COVID. And right now we want actually to have these learnings be well shared with other grassroots organizations or global organizations.
So Haki, we've been here for quite a long time. That's about close to 10 years right now, and we implemented different projects. Currently, we are partnering with Andy in their project of strengthening CSOs, and it's through this that we are trying to advocate for the rights of persons with disability, especially we are targeting children and youths. And during the implementation of this project, we realized to come up with a consortium, with a coalition, so that we can be able to strengthen our working in the whole community. And actually the coalition covers across the nation.
And advocacy is not a one-man show. It is where we come together so that our voices as organizations for people with disability and organizations for the disabled persons, together our voices are amplified so that people with disability themselves can be at the decision-making tables when formulating policies, express their challenges around implementation of policy to be able to facilitate their rights, access to their rights.
So the coalition members within the CSOs and DPOs in different counties came together and they actually made a strategy document. And the strategy document guides what exactly needs to be done in different counties. Like what is going to be done in Kiambu County might be different from what actually to be done in Machakos County, and differently, as we know, Kisumu is far ahead. It also gives some guidelines to other counties which are coming up. So basically, Andy has been playing the facilitative role rather than just actually taking everything on board on its own. So the members have learned what's need to be done. They've been actually getting adequate trainings on how to do advocacy issues for children and young people with disabilities. So I think right now they're ready to do it. It's only that now they need to come together, find funding, and then run the activities within the county themselves as DPO based within the various counties.
So for me, this coalition has been a very key vehicle, very important vehicle to be able to progress the agenda of protecting the rights of young people, of children, of people with disability, so that as a society we can embrace each other, we can live and let live, we can be able to integrate disability, mainstream disability in our work, so that it is no longer an issue about, people with disability being disabled by the way in which we do what we do, the way in which our physical environments are structured, our social environments, our information and communication, very important to make sure that all spheres of the sectors that we work in are accessible to persons with disability.
We identified some 2 areas we really want to advocate for. And these areas is one, inclusive education. Look at the schools we have around here, especially in Kibera, and I'll speak as chairman. The schools are not disability friendly. All the structures in Kibera, they are converted into schools. They are not disability friendly. So quite a number of children with disability will not be able to access education. This is not all in Kibera. It came out strongly during the coalition that even in other areas, as I mentioned, where we get our members all the way from Kwale to Busia to Kisumu to Homa Bay and other areas, including Siaya, not all institutions are disability friendly.
Our Kenyan constitution stipulates very well that education is every child's right, regardless of whether the child has any disability or not. And that's why we have teachers who are specifically trained to handle children with physical challenges.
May I confess that in most of our schools, they may not have implemented the Constitution as per the Article 54 on Bill of Rights, whereby children with disabilities should be, children with disabilities should have the environment adapted so that it can suit them.
The situation as it is for now is that the infrastructure in the education module is not conducive, even if a parent of a child with disability wants to take that child to school. Secondly, people with disability mainly come from very poor backgrounds. So this parent will not have enough time to take the child to school and time to get the same child back home. You see, you understand that kind of scenario. So the parent ends up hopeless. The
Minister of Education is committed to supporting our learners with disabilities in inclusive setups. So the ministry has done, there's some allocation of 2,300 shillings per child. Those that have been assessed and have placed in those particular schools, so that this money is used to adapt the environment, is used to buy teaching and learning materials, and it's also supposed to buy assistive devices for these learners. It's also supposed to buy co-curricular equipment so that as the others are in the field, there are those that may not go to the field, they need indoor activities. So this money comes to support that. However, this money is never enough. And again, not all the schools receive the FPE as a need top-up. That is what we call them, free primary education, special needs education top-up. Apart from what the regular child is assigned, or is allocated, it's this other money that is allocated to learners with special needs. But you see, not all the schools actually benefit from that. So it means, and you know that disability is everywhere. In all our schools, even our ECD centers, we have gone, we have found several children have disabilities, but they are not being assessed, and the school is not accessing that money to be able to adapt the environment and be able to provide what the child is supposed to have for meaningful teaching and learning.
Some of our parents see their special children as a problem. They have not yet embraced them. What we advise those parents that we have already identified is for them to form support groups. When they form support groups, at least when they come together as parents, this parent will see, at least I'm not the only one with a child with disability. So other parents will learn from that. We bring our parents together. For example, we have grant training with ADE for several parents from almost all our units in Thika, so in both Thika East and Thika West sub-counties, because I'm in charge of the 2 sub-counties. But there are those ones who are yet, like now we have a slum like Kiandutu, who have hidden their children in the houses. Not unless either a social worker identifies these children, or maybe the chief, this parent will never bring this child to school.
Number 2 is areas of employment. What are the employment policies? Are they disability friendly? We feel they are not, because look at the job adverts. As much as, yes, they don't desegregate, but at a given time, they are not friendly for the youth with disability. I know the government, actually, our president is talking about employment. Are youth with disability considered anywhere? They feel they are not considered anywhere. And even the job application, the job interviews and all this, and even workplace, how friendly are they? Do they have disability-friendly policies? This is one area we also thought we need to advocate and push the government to be able to ensure at least we are included in all these areas.
Mara nyingi nimekuwa nikiingia kwa media nikiongea kuhusu mambo ya walemavu kwa county, na gavana wetu Mvurya amejaribu kuandika kuajiri walemavu. Tumepata kuna subchief hapa area yangu, na pia kuna katika ofisi yake kuna security mlemavu ambao ni admin. Na ECD, hii shule za ECD tumeweza kupata walemavu ambao ni walimu pale. Amejaribu kupatia walemavu kazi. Sababu huwa saa yote niko kwa media na napiga kelele tu kwa media na akificha amejua.
Number 3 is in areas of health. Look at all health facilities. Walk into a health facility. Not all are disability friendly. If I may ask, in the area where we are working right now in Kibera, walk into all these health facilities around. None of the health facilities has a sign language nurse or a medic or a health service, medical health service provider. Why? Does it mean that those who are disabled and cannot be able to speak, cannot be able to express themselves, what they are feeling, how they should be able to access medication? This is a gap. We felt as a coalition, we need to push for this.
We are actually advocating here in Kirinyaga County for the county government to make sure that, as my colleague has said, there is medication for children with disabilities, because of their conditions. The health facilities to have enough services or sufficient services to serve children with disabilities at no cost or at very subsidized prices.
Key to challenges, remember this actually is bringing diverse groups of DPOs and coming from different counties. Then definitely there's the challenge of coordination. We all foresee like the coalition is to be registered, but you see that's not a force from the Action Network for the Disabled, but it's actually the members themselves within the coalition, and looking at where they're coming from and different levels of the CSOs and DPOs involved. Definitely we expect a challenge on how that the registration can be done of the coalition. So that's one of the key challenges, and that's one of the risk factors when you are actually developing this project.
kwa kama foundation ni foundation hatujapata wafadhili wa kuingia kusupport watu kila mwezi. Kuna desk nyingine tunapewa Msambiani, chief wa Msambiani mlemavu. Nilipoenda huko nikifanya mambo ya mobilization pale kuwapatia rights zao walemavu, alinipromise kupeana desk ya walemavu na akapatia mlemavu mmoja awe akiketi pale. Lakini changamoto ni kwamba huyo mwanamke huyo mlemavu atakaa pale, sasa nimwambia waangalie maslahi yake. Atakaa pale, jioni atadabila kitu, ikabidi sasa aende nyumbani. Kwa hivyo desk iko pale na ina kwa sababu hakuna mtu wa kumfadhili mwisho wa mwezi ama kupatia chochote. Sababu ataacha familia yake na hawezi fanya chochote, na unajua hali yetu ni vile iko.
The project has been very successful in a way. We've seen Kirinyaga coming up with the Disability Act draft, which actually presented to the National Assembly. We've seen Machakos County coming up with what we call accessibility law, whereby every kind of premise, every kind of building within Machakos County must be accessible for persons with disability. We've also seen Kwale County coming up with a Kwale County Disability Network. So that's at a county level, with something which had never been there before, and even they advocated to ensure at least the chiefs, that the sub-chiefs or area chiefs with disabilities employed in different sub-counties within Kwale. So somehow, on the capacity building of different CSOs has actually seen there's a good match between DPOs and CSOs in terms of implementation for child and young people with disabilities rights.
Mambo yote nimefanya through education yake. Advocates ambao wanipea ndio nilikuwa nikitoka Nairobi kwa seminar naja kuimplement hizo nyanjani. Actually what I can say kwa Andy, kushukuru Mungu kwa sababu hiyo yote nimefanya through wao. Nilipoanza foundation tu hivi nilipata mwaliko wa Andy. Nilipopata mwaliko wa Andy nilichoenda kufunzwa kule ndio nilikuja kufanya huko nyanjani. Kwa hivyo hiyo yote nimeshakwambia, yote ambayo nimefanya tena maana nastahili naendelea na kufanya ni kupitia Andy.
To me, I've seen quite a great impact as far as our caregivers are concerned. Before we trained them, they were just quiet. They couldn't be able to speak out. They couldn't be able to tell their problems. But after that, after we did the training, you can comfortably see them coming to my office. If there is any challenge that they have faced, maybe even in the school where their children are, they will comfortably either call me because I've given my number to every parent who cares to have my number, so that they tell me. I think I have that special passion for children with special needs, and also for the parents, because these parents go through so much, and at times, not at times, but I always understand them. When you get a special child, it becomes too hard for you. Life becomes too hard for you. A child is a child, regardless of whether a child has a disability or no disability. Our God is our maker. We don't know what that special thing that you have that I don't have. So I would say, when you get that child, try to do the best that you can for that child.
Disabled persons organizations cannot work as a single entity. They need to work with the civil society organizations in partnership with government closely to push for issues for children and young people with disabilities. Because what you've seen from the kind of movement we've been having, it's been very successful because of exactly DPOs within a county have come together and speak one voice, and that's the change has been caused.